But really the worst time for most people in terms of symptoms is when on the descent. When you're descending, the pressure changes that are experienced in the ear tend to be a lot more painful. And so when you're doing these types of things, doing it at those particular times is more helpful. If you're an adult, trying not to sleep or take a nap on the ascension or the descension is helpful too. Hi, I'm Dr. Reddy. This is Dr. Smith. Welcome to another episode of We Knows Noses. And today's episode, we will be discussing screaming babies and airplanes. Everyone's favorite thing, right? But the big question is, why are the babies screaming in the first place, which is what we're really going to be focusing on. And so we're going to be focusing on why do babies scream on airplanes, specifically when it comes from ear, nose, and throat perspective, because there's many other reasons why. And what we can do about that, as well as how we can help not just babies, but adults with similar problems.
Okay.
Do you want to get started?
Sure. So nobody knows entirely for sure why a baby might be screaming on an airplane, but it's thought to be likely due to the problem equalizing pressure within the ears. And a lot of that has to do with when the plane takes off, you need to equalize your ear, which is your middle ear sinus that ventilates into the back of the nose through that Eustachian tube, which we've talked about in previous episodes. Of course, as most people who have had babies know, babies can scream and cry for a whole host of reasons, hunger, fear, all the same things that stress us out as adults also stress babies out, but they just can't vocalize it as much. So it's presumed that a lot of times the kids might start screaming during takeoff or during landing because of pressure equalization problems.
Yep. And the adults are doing the same thing these days. They're acting like babies on planes. It's trending nowadays,
Yeah.
Right? When you're flying. But the medical term that we use that describes this problem is called Eustachian tube dysfunction. Basically, the pressure equalization tube doesn't open and close as easily and as well when you're having pressure changes when you're flying. And then the other thing that might be happening is something called sinus barotrauma, which is the pressure changes not only affects your ears, but your sinus cavities, which also have very narrow openings that can get swollen shut when you have altitude changes.
Right. And I used to think before having had it and experienced it myself, like how bad could that possibly be?
Mm-hmm.
The pressure, we've all had sinus pressure and pressure when diving underwater into the bottom of the deep end, that you get that ear pressure, sinus pressure. But having had it myself one time, the sinus barotrauma and ear barotrauma can be really exquisitely painful. To the point where you start to kind of break out into a sweat and are extremely uncomfortable. Pain medications may not seem to really help too much, like Tylenol and Motrin. But so if you've ever had it before, I certainly can sympathize with you. It's very uncomfortable to get that. So no wonder why a baby might cry if they were experiencing something like that.
Yep. So any tips that we have for babies and adults, and we can group this into two separate categories because a lot of the treatment options to help manage this on a flight involves some type of medication.
Right.
And, for adults, that's usually fine. But with kids, especially babies,
right,
try to avoid medications.
Correct. So normally, like the things that we think about, the first thing you try to tell somebody is how to like equalize their ear tubes is to try to yawn or try to pinch their nose and blow air into it. And you can't really do that all that well with an infant or a baby to tell them how to do it. So a pacifier is something that kids tend to use, a sucking motion, and that can help use the muscles that attach to the eustachian tube and pull those open. Feeding can help. So moms who are breastfeeding, if not bottle feeding, giving a kid a bottle or that sucking motion can help kind of pop and equalize pressure in the ears. Like adults, we tell them chew gum, try to yawn, Try to pinch and blow air into their ears. So insufflating is what the medical term is called. So trying to insufflate your middle ear with air to equalize the pressure.
Yep. And there's specific times of the flight that this is most important. So when you're ascending is one of the times, but really the worst time for most people in terms of symptoms is when on the descent. When you're descending, the pressure changes that are experienced in the ear tend to be a lot more painful. And so when you're doing these types of things, doing it at those particular times is more helpful. If you're an adult, trying not to sleep or take a nap on the ascension or the descension is helpful too. So you don't have that post, like when you're getting off the plane, for example, your ears are all muffled. With babies, it might be easier just to try to get them to nap during that time. So we talked about the insufflation, and what about medication? Any tips on medication at all?
Sure. So I normally tell my patients, I give them my quote, fly and dive instructions. And typically it's a decongestant type of protocol. If it's someone who commonly gets it, I may even have them start a nasal steroid a couple weeks ahead of time to try to best condition the eustachian tube for decreasing the amount of inflammation that may be in there. I normally tell my patients to take a pseudoephedrine as long as they don't have blood pressure issues. I tell them to take a pseudoephedrine oral decongestant about an hour or two prior to the flight. And I usually tell them to take Afrin, which is a nasal decongestant, typically about when they're about to board the flight, because the oral decongestants take a little time to get effect and work. The nasal decongestants typically work pretty fast. Now, do you typically tell patients to like redose or like about the time of the flights? And
Yeah. I mean, you try to because Afrin works pretty quickly. So in a few minutes, typically Afrin will work. So especially right before the ascension and right before the descension, you just do a couple sprays of Afrin. And I think that's helpful. Sometimes in severe cases, if patients have like a lot of problems and they're traveling and they're going on vacation, don't want to have trouble, we can prescribe a course of steroids for them to take as a backup if things are still a problem. There's these little devices you can get for your ears called earplanes. I don't know if any of your patients use.
Yeah, I often recommend those too.
And, I've had kind of mixed results with it, but the idea is that it reduces it smoothens out the pressure changes so that the pressure drops aren't as significant, and it kind of smooths out a little bit. It can kind of give you more time to equalize your pressure in your ear, and more slowly, essentially.
Right. Sometimes people will actually use their AirPods or their silicone earbuds that kind of perform something similar. Now, an earbud would fully seal the canal, so you might need to kind of slowly take it out and put it back in to kind of slow that pressure change on the outside of the ear compared to the middle ear. But the ear planes just kind of have a small valve that allows the air pressure to slowly dissipate across that barrier. But we actually just had a colleague that took a flight and about the baby screaming on the airplane. For you, if you're dealing with the baby screaming on the airplane, noise canceling headphones work pretty well. Then you don't hear the baby.
Yeah. Or not traveling with babies. That's another good idea.
We used to have a partner that we worked with that when he would have, he had these little silicone earbuds and a little case, and it said for baby foreign body removal. And I thought, well, how does these help remove foreign bodies from a baby's ear? And he said, they're not for the baby's ear, they're for my ears. But when I remove the foreign body so that I don't hear the baby screaming. So for the baby, be sympathetic to the family who may be taking care of them. But for you, AirPods might actually help with your own air equalization, but they also help block out the screaming baby as well.
And then the last thing maybe we can go over is, let's say you have a baby and maybe you've been on a flight and you know that the baby has trouble, right, with flights. And so what can you do maybe as a prevention or an anticipation of going on the flight with the baby? And you can't do a lot of those medications that we prescribe because they're not FDA approved for infants.
Right.
But simple things you can do is just a saline nasal spray.
Yep.
Right. In anticipation of a flight, maybe for like a week prior to the flight, you're just trying to keep the nose as clean as possible and trying to ventilate the nose and the eustachian tube in the back of the nose so that it gives it the best shot of working.
Yep. So nasal suctioning tools and devices are very helpful. The saline sprays are very helpful.
Yep.
In the babies.
And then if the baby has any allergies to the environment, you try to treat the allergies, trying to avoid any allergens, trying to avoid any viral exposures prior to flying.
Right.
Like trying to avoid sick contacts, frequent hand washing. The worst thing is if you're sick and then you have eustachian tube problems and then you have to fly.
Yeah.
That's the worst. So,
and there is another thing that we can talk about just briefly here before maybe we close this out, but procedures for patients that might be, little kids, most of us know, end up getting ear tubes, right? So if kids have problems with eustachian tube dysfunction, often not just for flights, because usually kids aren't taking a ton of flights and having the problem. Usually it's more for infections, but adults, we often may end up getting ear tubes if they have problems flying, and that helps with equalizing the ear pressure because then there's a vent directly into the middle ear. But what other options have come out that might be more beneficial for adults?
Yep. So, there's minimally invasive options now that we can do in the office. The most common thing that we do is something called balloon eustachian tube dilation, which is an alternative to ear tubes. It's actually technically less invasive, and you don't have to worry about water getting in your ears. It's just trying to make your natural eustachian tube function better. And you can also consider balloon sinuplasty if you have something like sinus barotrauma, where your sinus passages are a little narrow.
Yeah, I think we've talked about this offline, but both of us have had patients that have been stricken with barotrauma frequently and then are fearful of flying. I've had patients who won't fly to Europe because of the length of the flight and the altitude changes, and they have such barotrauma and pressure. We've had pilots and flight attendants that suffer from it, which is really difficult when it's your job and you have to be on the flight frequently. And those patients have had, thankfully, successful eustachian tube dilations and have gone on and done fantastic on flights and things going forward. So barotrauma is an indication so it's not just infections and things now. A barotrauma is an indication for those dilations, such as a sinus dilation or eustachian tube dilation. So if you do experience those symptoms and you do experience them frequently, find an ENT such as ourselves who may be able to or may be experts in those minimally invasive procedures, because they do significantly improve someone's quality of life when it comes to flying and diving.
Agreed. I think that's it.
Yeah.
We have today, right?
That's all we have.
Yep. So thank you for joining us, and be sympathetic to those screaming babies on airplanes. We'll see you next time.